Okay. Hand hygiene. Okay. Hello, next Miss morning, Romualdo, Miss Romualdo. My name is Jennifer. I'm going to be your nurse today. Can I come in? Yes. Okay. So I'm going to go ahead. Do you mind if I check your armband really quick? Can you tell me your first and last name and date of birth, please?
Morning, Romualdo, 1979.
All right. Thank you. All right. So, Miss Romualdo, we're gonna do a physical exam. It's gonna take about 10-15 minutes. Is this a good time for you?
Yes.
All right. So, can you tell me if you have any allergies I should be aware of?
Allergies.
Okay. Do you have any pain right now? If you can rate it 0 to 10, 10 being the worst.
0. No pain.
Sounds good. Thank you. All right. So let's go ahead and get started with the assessment. Patient. I'm sorry. Hold on. All right. So patient appears stated age, behavior is appropriate, speech is clear, uh, facial expression is relaxed, mood and affect are appropriate, and all right. Miss Ronaldo, can you tell me where you are?
Yes. I'm in the library.
Okay. Can you tell me what time it is?
It's about 5 o'clock.
All right. Sounds good. Can you tell me why you're here?
To practice our assessment.
Okay. Sounds good. That's stop. Anyways, all right. And all right, so patient is alert and oriented times 4 and no signs of acute distress. And all right, so let's go ahead and proceed with the vitals. Take your, see your left arm, please. Sorry. Blood pressure is 122 over 76. Sorry. O2 saturation. Just need your finger here and take the temperature. 89.4. Temperature is 89.4. 22. 76, right? And O2 saturation is 98% on room air. Alright, so I'm going to go ahead and take your pulse. Okay, so pulse is 72 and respiration is 16. All right, so that's it for the vitals. I'm going to go ahead and lift your bed up. All right, so patient skin tone is even and normal for ethnicity, no signs of wound sensations or lesions. Bed is up, so I'm going to go ahead and just feel your, do you mind if I just feel your skin, okay? And okay, so patient skin is warm and dry to touch. Skin turgor is within normal limits. Can you see your nails, please? All right, so nails are within normal limits. capillary refill is less than 2 seconds. Okay, go ahead. Thank you. All right, so Braden scale is 23 out of 23. All right, so let's go ahead and do the head assessment. Okay. All right, so facial features are symmetrical. I'm going to just go ahead and feel your head. So head is normal cephalic, hair is dry and evenly distributed. No signs of lesions and infestations, and temporal artery. Temporal artery is 2 plus and equal. Okay, do you feel any pain or pressure?
Yep.
How about this? Any pain or pressure? Okay, so frontal and maxillary sinuses are within normal limits. I'm going to go ahead and check your eyes. Just look at me directly. And just go ahead and follow the tip of my pen light with just with your eyes. Okay, so eyes are Perla EOMI. Now let's go take a look at the ears. Okay, so I'm going to do the Weber test, okay? Now tell me, can you hear this?
Yes.
Okay, sounds good. Just place this behind your ear. Just tell me when you cannot hear this.
No.
Can you hear this?
Yes.
On the other side? Tell me when you cannot hear.
No.
Can you hear this?
Yes.
Sounds good. Right, I'm going to go behind you. Just do a whisper test. Can you cover your left ear and just repeat what I say?
Okay. Banana.
Okay. You have to cover the right ear. Just repeat what I say. Okay. All right. So ears are clean. Whisper, Weber, and Rhine. Whisper, Weber, and Rhine test are within normal limits. Okay. So I'm going to go ahead and look at your nose. You can just go ahead and look up for me. All right. Do me a favor. Cover one nostril and breathe in. Okay. Do the other side. Any problem with that? No. Okay. So nose is clear and patent. All right. I'm going to look at your mouth. Alright, and say okay, so buccal mucosa, gum, teeth, tongue, tonsil, lips are all within normal limits, and soft palate rises on command. Alright, so I'm going to go ahead and fill your trachea is midline, and I'm just going to fill your carotid. So carotid is 2 plus and equal. I'm going to do the lymph node. Preauricular, post-auricular, occipital, jugular digastric, submandibular, segmental, deep cervical chain, and supraclavicular are all non-palpable and untender. And let's do the lung sound now. Okay, so I'm going to go ahead and listen to your lungs. Facing that way for me, please. Towards that wall. Thank you. Now, when you feel my stethoscope, I just need you to take a deep breath. Okay? Just do the same thing. Let me look this way for a moment. Just do the same thing. Okay? Go ahead and begin to lift up. So posterior and anterior lung sounds are clear in all field. Breathing is easy and unlabored. All right, so I'm going to go ahead and listen to your heart. Now, if I stay in one place, I'm just listening, okay? Are you ready? Pulmonic, Erb's point. Go ahead and lift it up for me, please. Tricuspid. And I'm just going to stay here for a minute. Mitral. I'm going to listen now this time with the bell, okay? Now I'm going to tell you, do you mind laying down, Miss Romualdo? Okay. Pulmonic, Erb's point, tricuspid, and mitral. Okay, sounds good. So heart is regular rate and rhythm. And since you're laying down, I'm going to go ahead and lift your, kind of put your bed up to a 45-degree angle. And I'm going to have you look that way for me, please. Okay, on the other side. All right, so no JVD present. Now I'm going to go ahead, I did your capillary refill. Okay, so I'm going to look at your tibial. No signs of pretibial edema. All right, so I'm feeling for the posterior. All right, posterior tibial pulses are 1+ and equal. Now I'm feeling for the dorsalis pedis pulses. It's 2+ and equal. All right, so I think that concludes our health assessment, physical assessment. Ms. Romualdo, I'm putting the bed down. You can go ahead and put your clothes back in. This is your call light. And do you have any question for me? All right. Is there anything I can get you before I leave?
Good, thank you.
All right. So I am gonna. The doctor will be here shortly, and thank you for your time. Okay. All right. All right. S4. All right. So my patient is 28 years old, Hispanic female. All right, Hispanic female, who came in for an exam today. She is alert and oriented ×4. Patient stated no pain. Behavior is appropriate. Speech is clear. Facial speech is good hygiene and well nourished. Blood pressure is 122/76. Pulse is 72. O2 saturation is 98% unknown air. Respiration is 16. And temperature is 99.4 degree Fahrenheit. Now, patient's skin is consistent with ethnicity. Nails are within normal limits. Capillary refill is less than 2 seconds. Braden scale is 23 out of 23. Head is normocephalic. Temporal artery is 2 plus and equal. Eyes are Perla EOMI. Ears are clean. And hearing, Weber, Whisper, Ryan are within normal limits. Nose is clean and clear and patent. Trachea is midline. Lymph nodes, preauricular, postauricular, occipital, jugulo-digastric, submandibular, submental, deep cervical chain, and supraclavicular are within normal limits, non-palpable and non-tender, and carotid is 2 plus and equal. Lung sounds are posterior and anterior lung sounds are clear in all fields. Breathing is easy and unlabored. Chest. For the chest, heart is regular rate and rhythm, no JVD present, no pre-tibial edema noted. Posterior tibial pulses are 1 plus and equal. Dorsalis pedis pulses is 2 plus and equal. Thank you.